When pregnant workers are forced off the job because their employers refuse to provide them the modest accommodations they may need to stay healthy, it often leads to devastating economic consequences. We've routinely heard from women who have lost their health insurance, wound up homeless, on food stamps. So this helps exacerbate the gender wage gap, but it also pushes women deeper into poverty, deeper into economic insecurity.
This is something that really goes to the heart of who we are as human beings, taking care of our children when we have them, and taking care of our aging parents, taking care of our loved ones.
A better balance is using the power of the law to help workers care for themselves and their loved ones without risking their economic security. We've worked in over 40 states and localities over the last 15 years to advance policies such as paid sick time, paid family leave, pregnancy, breastfeeding accommodations, fair and supportive scheduling, and more. We're also leading efforts in Congress to pass legislation to bring these protections on the federal level.
But in addition to our legislative work, we also do litigation to make sure that the rights that we have gotten for people are enforced. We do know your rights work so that workers know about their rights.
And I'm particularly proud of our free legal helpline because we truly center the needs of workers and help ensure that they are armed with the information that they need to advocate for their rights in the workplace.
So many organizations are either advocacy organizations for policies or they work with workers on the ground. We do both. And what we hear from workers really informs what we are fighting for and how we're fighting for those laws and policies.
We've heard from pregnant workers who are denied bathroom breaks, who are not allowed to carry a water bottle on the job, who are not allowed to modify their schedule by 5 minutes. But the issues really extend beyond pregnancy.
I remember Alexandra, she worked at a bank. She had a good job. She'd worked there for several years. And her daughter suddenly went into shock and she had to take her to the hospital. She called her supervisor at the bank and said that she was going to have to take one day off to stay at the hospital with her daughter. But when she came back to work the next day, she found she'd been fired for taking that day of sick time that she hadn't accrued, and so therefore they fired her.
We must remember and center those women who must show up for work, who have to be on their feet, who may not have the safe and supportive workplaces, just the basic ability to be able to take care of your health, to be able to follow your doctor's orders. That is just such a fundamental right in this country. It's a human right, I believe, and this is fundamental gender equality, it's fundamental racial equality, economic justice, maternal health. It's such a core issue.
As women become more powerful and really take on more of a public voice, I think that we have more of a chance to really push our message and push for rights for the people that we know deserve them. And we're going to fight to make sure that our society really does value care and the work of care going forward.